Okay, this video is Alzheimer's dementia, a joke. One of the viewers asked me to make a quick introductory video about dementia because a lot of people have demented parents and older persons in their family, and they're kind of confused about what to do. And the patients are typically told that the old person has Alzheimer's dementia. Okay, my name is Peter Rogers, MD. I'm a world-class expert on dementia. I'm the author of this book right here, Poor Man's Way to Prevent Dementia and Raise IQ. And I'm going to tell you right now, Alzheimer's dementia is a joke, okay? It's a trick. It's labeled as the most common cause of dementia. Even neurologists will tell you Alzheimer's is the most common cause of dementia. But when you look at it closely, you'll see that the whole thing is BS. Why do I say that? Number one, what's the historical question you can ask a patient to diagnose Alzheimer's? There is none. There's no reliable question you can ask to confirm the diagnosis. Well, what's the physical exam finding? Can you put a stethoscope on them? Can you palpate them to confirm the diagnosis of Alzheimer's? No, you can't. There's no way to do that. Well, what's the reliable blood test? There is no reliable blood test. I know they're working on some things in the laboratory, but they don't have anything that can reliably diagnose the so-called Alzheimer's. All right, so then you say, well, what about imaging? You can do, a CAT scan. You can't diagnose Alzheimer's with a CAT scan of the brain, okay? Well, you can do an MRI, and theoretically they'll say you'll have parietal lobe, medial temporal lobe atrophy, but you almost never see that pattern. I look at tons of brain MRIs. I almost never see that as a characteristic pattern. The vast majority of patients who are demented, I just see a shrunken brain. That's atrophic brain. It's gotten smaller because it's losing so many neurons. Yes, I sometimes see a whole bunch of periventricular so-called silent strokes, but most often I don't see that many. And sometimes there's a big stroke or something like that. Of course, there's rare causes of dementia, okay? So-called multi-infarct dementia. It's usually not that, okay? Okay, so then the next thing is, well, what about nuclear medicine tests? They can suggest an increased accumulation of amyloid, but they can't effectively confirm the diagnosis. And you say, well, of course they can at autopsy. Some people even think the so-called extracellular senile plaques and the intracellular neurofibrillary tangles are pathognomonic. They are not. They'll find the same things in people who they don't think have Alzheimer's that aren't demented at all. And that's part of what that Mankato, Minnesota, Notre Dame nun study was all about, as a way to try to rationalize it. So supposedly the nuns who were more intellectual, more academic, like to read more, like to teach more, like to write letters more, had lots of the characteristic findings of Alzheimer's, but they weren't demented. And so instead of saying, well, gee, that confirms the theory is bogus, what they do is they say, well, that just confirms they had more cognitive reserve so they could handle more lesions in their brain without becoming demented. And then the next question is, well, what does conventional medicine use to treat so-called Alzheimer's dementia? And they'll give you pills, things like Aricept, or they got these new monoclonal antibody drugs. They don't work very well. And in my opinion, the whole thing is stupid. And the reason why I don't like is that it leaves the patient helpless with nothing that they can do to try to improve the situation. The two best theories of dementia are the Jack Delatorre theory, right here. You can call it, some people have called it the vascular hypothesis of dementia. I call it the mouse equivalent theory, and I'll explain why in just a moment. And the other theory is the neurovascular uncoupling theory by me, Peter Rogers. That's the Peter Rogers, MD, neurovascular uncoupling theory of dementia. NVU is neurovascular uncoupling. Okay, so anyways, let's talk real quick about Jack Delatorre. So Jack Delatorre took mice and he would tie off the carotid artery in their neck. That is the blood flow to the anterior part of the brain on each side. And the mouse, if it was middle-aged or older, would become demented about 2 months later. Younger mice would not become demented because they have more reserve in terms of the ability to compensate for diminished blood supply and develop collateral vessels, like detour routes of blood vessels to perfuse that brain. So the mouse did not become overtly demented, but middle-aged and older mice did. Okay. He did a whole bunch of experiments. He tied off both carotid arteries in the neck. Then he started tying off the middle cerebral arteries in the brain. He tied off the posterior circulation, the vertebral arteries. And the bottom line was, when you underperfuse the brain, that means significantly diminish the blood supply to it, the mice will tend to become demented. Okay, so at first glance, one might say, well, so what? Not that many people have cervical, neck internal carotid artery occlusions. Well, lots of people have things that are about the same. If you have hypertension and you overtreat it, dropping their pressure too low, you can induce the same phenomenon. I call that a mouse equivalent. Okay, why do you have a blood pressure in the first place? To get blood to the top of your brain, okay? To pump against gravity. The highest thing, the most high against gravity is the top of your brain, the cerebral cortex, overlying the convexity of your frontal and parietal lobes. Okay, Well, what else can do that? Well, if you have congestive heart failure, lots of patients have that. That means underpumping of blood to the brain. How about if you have an aortic valve problem, aortic stenosis, aortic regurgitation, underpumping of blood to the brain? Okay, how about if you have atrial fibrillation? That means decreased atrial fillings in terms of less atrial ability to generate the atrial kick to filling of the ventricle, the left ventricle, for sending blood up to the brain. It's going to diminish the amount of blood getting to your brain. That could be a mouse equivalent, okay? Then also, if you just have chronic hypertension and chronic diabetes, they're going to damage the arteries in the brain, the small capillaries, and they're going to diminish the oxygen delivery to the tissue. So it's essentially a mouse equivalent, all right? So those are all your sort of standard mouse equivalents that match the Jack Delatour theory. His book is very good, and he explains why conventional theory for Alzheimer's is bogus. He explains why aluminum theory just, is part of the whole process, but it's a weak explanatory idea. There's just not enough aluminum, and it's not high enough in places where they still have a lot of dementia to explain it. So don't get me wrong, aluminum is a neurotoxin, but by itself, it can't be the main thing causing dementia. Okay, what else is good about Delatore's book? That's the main stuff right there. Okay, and I've made longer videos where I go into more detail about his research. Okay, and then my theory is what's called neurovascular uncoupling. I go into a lot more detail about it in longer videos and in the book, of course, but you can watch my videos. I'll explain everything to you. It's pretty simple. The bottom line is you have a baseline metabolic rate, and that has normally to be coupled to an equal amount of oxygen and glucose delivery, an equal amount of blood flow. But when people take stimulants like caffeine or tobacco, or the main excitatory neurotransmitter in the brain is glutamate. That's about 90% of brain excitatory neurotransmitters is glutamate. It's the on switch for activating a brain cell. The off switch is GABA, okay? But GABA is only about 5% of brain neurotransmitters. And then the other remaining 5% out of the 100% total is things like, the more famous neurotransmitters, dopamine, serotonin, epinephrine, norepinephrine, acetylcholine. Okay, but those are actually relatively rare in the brain in comparison to glutamate. And so, monosodium glutamate, MSG, which is put in food all over the place because it makes it taste good. But actually more common nowadays is MFG, manufactured free glutamate, which they obtain just by chopping up a protein to free up the individual glutamate amino acids. Glutamate is a type of amino acid. And so they can sort of overwhelm your system and make a food taste great, make the food even addictive, but it can overwhelm your body's ability to sequester it and have an excitatory effect on your brain. There's also some areas of the brain that lack on a blood-brain barrier, like the circumventricular organs around the third ventricle and chemosensor areas of your hypothalamus, for example, and your posterior brainstem, like the area posterior of the vomiting center, for example. Okay, well, anyways, it gets worse. There's a whole bunch of other things. Aspartame, the sweetener, that's also an excitotoxin. It has an effect similar to glutamate. It activates the NMDA receptor, so it has an excitatory effect on the postsynaptic neuron. What about glyphosate? That's what's sprayed on the non-organic soy. Plus, there's other non-organic foods they spray glyphosate on prior to harvesting, and that includes beans, that includes oats, and includes some other foods. Okay, it's an excitotoxin effect. And then the other thing that's not widely known is there's a whole bunch of mitochondrial inhibitors. In order to deactivate a neuron, to turn it off, you have to pump calcium out of the cytoplasm. Everything is based on calcium, by the way. Elevated cytoplasm elevated calcium in the cytoplasm of a neuron activates it. So in order to deactivate a neuron, the cell has to pump that calcium out of the cytoplasm. Well, to pump calcium, you need ATP. ATP is the energy currency of the cell. It's like a $20 bill in a cell. Well, guess what? Where is the ATP made? It's made in the mitochondria. Well, guess what? Processed food has lots of fungal inhibitors in it so that mold doesn't grow and it doesn't get returned to the company. So guess what? When you eat that fungal inhibitor, it could potentially inhibit the mitochondria in your brain. Get it? Then you can't make the ATP. You can't pump out the calcium. Your brain cells say overexcited. Holding up your cell phone to your brain up close increases the amount of EMF, electromotive force, which opens up the voltage-gated calcium channels in your brain. And then that can also overexcite your neuron. I think that's why so many young people are sort of anxious, attention deficit, and they can't concentrate well. They've got brain fog. Basically, they're becoming stupid. And there's a whole bunch of other mitochondrial inhibitors. Lots of things that are common. SSRIs, selective serotonin reuptake inhibitors, antidepressant drugs, a lot of antibiotics, including the fluoroquinolones, aminoglycosides, for example. Excessive amounts of saturated fat, like the typical fat in animal foods, lipid peroxidation products from eating omega-6 cooking oils. Some of these estrogenic chemicals like BPA, bisphenol A, is also mitochondrial toxic. Atrazine, which is sprayed on the non-organic corn, which is used to sweeten things, high fructose corn syrup, is a mitochondrial inhibitor. It inhibits complex 3, so it's toxic to your mitochondria. It's a brain toxin. Okay, and there's a whole bunch of other ones. So I think that the combination of these effects here is why people are becoming demented. And the good news is these are logical things. You can make sense out of them and you can avoid them. So doing all those things will lower your risk of becoming demented and will help to slow the progression if you're already having some cognitive impairment. Cognitive impairment in Americans is super common. I routinely expect, if I talk to a patient 60 years and older, that they're going to be cognitively slow. Not frankly demented initially, but I see a tremendous amount of cognitively impaired people and demented people. I've seen, unfortunately, a lot of patients in their 40s that are demented. They're demented from traumatic brain injuries. They're demented from severe hypertension, causing little tiny intracranial bleeds, microbleeds. So anyways, the important thing I wanted to get was to let you know that this whole Alzheimer's thing I think is bogus. You can't diagnose it and you can't treat it. That sounds like BS. And the poor patient is stuck with a diagnosis that doesn't make any sense to them or to anybody else, and there is no treatment for it. Whereas if you understand Delatorre's theory, you understand my theory, then there's a whole bunch of things you can do to help lower your risk, and there's a whole bunch of things you can do to try to slow the progression, and it makes sense. And guess what? It doesn't cost you anything. And that's why I never get invited to be interviewed anywhere, because I'm telling you how to help yourself without saying you got to spend any money. And big business don't like that. Well, anyways, I hope this is helpful to you.